Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. Follow us, like us on Facebook, facebook.com/. This Week in America. As mentioned, back with us on the program, Irene Chain-Kalinowski is a registered nurse, a registered midwife with a postgraduate degree in health sciences. She has served as a midwife in 3 continents, Middle East, United Kingdom, or native New Zealand, both in hospitals and in an independent midwifery practice. She's been midwife for over 35 years, delivered more than 2,000 babies, literally has seen it all. She had her book, My Body, My Baby, Take Charge of Your Childbirth Experience and Celebrate It last year. She was on the program to talk about it. A new book to be out soon called Let It Be. And she's back with us on the program today via Skype. Irene, welcome to the program. Great to have you back with us.
Thank you. It's a pleasure to be back. So many things happening since last time.
Well, it's really the case, and so many interesting things and important things we need to talk about. I'm going to start with a statistic, and then we'll get where we are recently. And this was one that we talked about the last time, and I had so many people say, wow, those are staggering numbers. More than 30% of women in the U.S. have cesarean sections. 80% use some form of pain medications, and for Irene and her clients, 95% of deliveries are uncomplicated and drug-free. Are we making any progress to get some of those statistics from the U.S. more in line with what you're seeing with your clients?
I think there's a global trend now. We're all working together to try and reduce those statistics. The United Nations have launched the Prenatal 2014 initiative to bring back spirituality and humanity back into education. I'm in touch with thousands of healthcare professionals around the world trying to make these changes. So, and I think obstetricians and the medical system are realizing this, and they're wanting to make changes too. So it's good for women, really.
Information on Irene, of course, you go to our website, thisweekinamerican.us, or you can go to Facebook. It's very simple to remember. Her website is facebook.com/My Body, My Baby. Information there. It's interesting. I saw a release. In fact, you had sent it to me a while back from the American College of Obstetricians and Gynecologists. And they talk a lot about the actual birth. And something that I know is at the forefront of your message is really that preparation needs to begin long before birth. It's almost, if we focus on birth and only concentrate on that, we're really asking for problems, aren't we?
I think that's the problem sometimes with medical training and research. It focuses on mainly one thing. And I think we've got to go back to the roots. And the roots of that are, I'm giving a lecture at the International Obs-Gynae Women's Conference in 2014 in Chicago. And, I'll give a talk a little bit about an abstract, and that abstract's about, perineal repair in women, preventing tears. Well, everything focuses on, stretching, everything with the perineum, but nobody says, well, excuse me, but what diet are we telling the women to eat so their muscles are healthy, so their skin's healthy for stretching? When we start to go back and do that kind of preparation, we won't have as many tears and things like that to sort out. It just doesn't make sense that we're focusing on one thing. And it's the same with just looking at childbirth. You can't just look at childbirth itself or the delivery room. You've got to look at way beyond that. People come and they've got no idea about their own body. Nobody's educated in school. It's one of the natural everyday events to have a baby, but nobody's prepared for it. So women come to me absolutely scared of childbirth in the beginning because they don't know anything about it or their body.
Some of the things that you focus on, and again, the book we talked about it before, My Body, My Baby, which is excellent. It's available at Amazon, available at the website, facebook.com/My Body, My Baby. Being psychologically prepared. You mentioned women will come to you and they're really fearful of what they're about to go through. How difficult is it to be psychologically prepared? Obviously, you have to talk to the right person and you have to start it in plenty of time so that you're in the right mental state.
Well, actually, it's not too difficult when women come to my clinic because I'm a homeopath and I've studied about 3,000 remedies, and we actually work on the emotional fear because we've got the mind-body connection. So if someone walks into my office, I can actually see straight through them. And I think it would be wonderful if everyone was taught these, holistic skills to be able to do that. If a woman comes and she's got urinary problems and there's no the clinical symptoms are there, but there's nothing pending that she's got an infection, and then you bring in the chakra system, and you'll say, well, have you had an argument with your boyfriend? And she'll say, well, how do you know that? It's all connected, and I'd love to see that kind of education come out into our universities. It means changing the way we teach medically to bring that mind-body connection in.
It's interesting because I guess when you break it down in its simplest form, healthy women produce healthy babies. It's not all that complicated, is it?
It's not complicated, actually. If they eat the right foods, if they take charge of it. We've got a problem in the world today because of the fast and the refined foods. Well, a lot of carbohydrate, a lot of fat intake can affect the liver, and then sometimes, very rarely, I think 1 in 10 to 1 in 17,000 chance, there's a underhidden cause with the liver that doesn't come out until the birth. So that's why it's so important to tell people, you need to bring your kids up and eat healthily. My grandmother lived till 101, my auntie lived till 99, and they ate like the home-grown soups, which don't cost a lot of money, but they were healthy. The lunchbox has become the norm in our schools, and we need to go back to the days of all the kids having a healthy meal.
Irene Chain-Kalinowski is our guest on the program. The website is facebook.com/mybodymybaby. Let's talk about the maternity units. Some are so bare and stark and frightening, and I think we talked about it in the last program, and you talk about it in the book. What we really need to do to upgrade the maternity units so that you're not afraid of the unit as well as the experience you're going through.
Absolutely. Many units are quite structured, and it's really, really scary when you've never been into hospital before in your life. And, you see all this medical equipment, it's stale, it's sterile. And even, the body, the anxieties put up a blood pressure. I know that when I always remember when we were in the hospitals and women would come in and they'd have their antenatal visits, and usually you'd find an elevated blood pressure. And then you realize when you calm them and you've reassured them and you take that blood pressure, it's dropped down. Well, I often wonder, with our sterile and bland, scary units, as you might want to call them, what does it affect, and how does it affect the women, and how does it affect the way we perceive care? Because if someone comes in and their blood pressure's high, do you think, let me sort her emotions out first, let's get her calm first, let's relax her before we start making judgments?
That's interesting, and we keep coming back to this holistic approach and treating the entire person, not just waiting for something to happen and counting off weeks and months until we get close to delivery. It really does begin early in the process, doesn't it, where they really need to be concerned about what they're going through and, I guess, understand and be educated about that process.
Absolutely. They need to know their body. They need to know what their muscles do in their body during childbirth. They need to know, the development stages of their baby. The first few weeks are a prime example when all their cognitive things are coming in, and, they're getting their hearing, their sense of smell. It's such an important stage. And yet that education and that learning and that prevention should happen well before women get pregnant.
And men need to be involved in this. You make that case that we really need to be right there and understand what's going on and be supportive of what is happening.
Absolutely, because if you don't know what's happening, we also get the nervous husband. So I get the anxious woman, the anxious husband, and the anxious family in the birthing room unless they're prepared. And all this impedes onto outcomes.
I can definitely relate to that. During the birth of one of ours, they actually asked me to leave for a little while. I was making everybody nervous, not just my wife. She was used to my behavior, but the doctors and the nurses and everybody, and they asked me to leave. And that was basically my lack of understanding, my fear of what was going on.
Well, it was actually because men were locked out of delivery rooms many years ago. I mean, if you go to many places in India, the men are not allowed in the rooms. And, I look after many cultures that come from India and the Middle East, where sometimes the men are not in the rooms and they're very nervous and they're just sitting outside and they don't want to be anywhere near it. And I think that's so wrong, because when men understand, they really appreciate their wives a bit more when they see what they go through.
Well, that is actually the case, and it was just starting to change the last time I was there, where they were sort of allowing you to get in, and they were asking, "You don't want to come in to the delivery room, do you?" So they weren't really welcoming you. They sort of thought that they had to do that. But yes, because I was totally unprepared for that experience. I mentioned in the beginning that you've practiced midwifery on a number of different continents. Talk about how that is to understand, because you're dealing with different cultures, and how important that is that the caregivers actually, and you can be based in Chicago and in a day see people from a broad spectrum of different cultures. How important is that to understand the background of the woman who's coming in?
I think you need to understand the background of the way they're birthed in their own country, how their mother's birthed, what their perception around the birth is, and then how you can kind of change that, because there is a lot of education. I sometimes wonder how my grandmother did it in the villages of Poland without the knowledge that we have today. Women birthed, and they birthed well, and they had few complications. And I used to say, "Did anybody die in all those years, Grandma?" And she said, "No, nobody." So, when you understand, like, the herbs, all those things coming together actually make that a person. I talked before about women in China. There's a high cesarean rate, so they come through expecting very high tech care. Because it's the norm for them. So you have to kind of get to the roots of it so you can change their thinking around birth.
Irene Chain-Kalinowski, our guest on the program. The most recent book is called My Body, My Baby. She's got a new book coming out called Let It Be, and we'll have her back and we'll talk about that as well. Several other publications. You can get all the information at her Facebook site, which is facebook.com/My Body, My Baby. You've said not only women need to regain faith in childbirth, but our medical profession needs to as well. And I know that you are doing everything you can in terms of outreach. You're coming over to the U.S. this summer in Chicago to do that as well. How receptive is the medical community to what you're trying to tell them, the message you have?
Well, I've got lots of contacts. Through the globe. I got through LinkedIn ever since I started. I think I'm heading off now for maybe 1,800 contacts globally. And, I'm getting lots of feedbacks. There are obstetricians in the Middle East. There's obstetricians in Greece. There's obstetricians in America, all wanting to provide holistic health. But sometimes our longer establishments have become so much of an institution, it's hard to break the shell, because it's always a policy and protocol of things that they've always done for the last 30 years. And it takes a bit of breaking into.
Irene Chain-Kalinowski, our guest on the program. A very important book, My Body, My Baby. Got a couple minutes left in the program. It's going by way too quickly. When I mentioned the statistic in the beginning, the births that you've been involved in have very low complication rate. Is it a lack of knowledge that leads to complications?
It's a lack of knowledge, and it's a lack of, like I say, when women are educated and coached and they do all the right things, they eat the right foods, they walk, they exercise, you give them confidence, you work with their mindsets, and you get the beautiful outcomes. So, yeah, basically that's what you need to do to be able to get the normal and the less complications. I look, when I first came out into independent practice, and I hadn't done homeopathy, and I have to say that my care then was not holistic, and I kept asking myself, why is this happening? And then when I moved out into the holistic world and put everything together, so, it's not just hypnobirthing, it's hypnobirthing with the right preparation. It's the chiropractor if the baby's not in the right place. So you use acupuncture can help stimulate the organs to work. So it's putting all those concepts together to get those outcomes. And I'm seeing more and more of my women come out without complications. They're going home with babies. And I get referrals from all around Auckland wanting me to come, wanting to deliver their babies in the holistic way. Because the majority of women don't want C-sections. They want to just go home and have their babies. And my niece, actually, I wrote the book My Body, My Baby for her, and she actually had a home birth, a vaginal birth at home in Australia because she was frightened of the system. She didn't want to go back. They took away her control, and this time she did it. And we knew she could do it because my grandmother did it, her mother did it, her grandmother did it, and she did. And we have a beautiful new baby. So, if it wasn't for Joe's first time, I probably wouldn't have written the book, because I think you get a little bit more involved when it becomes family.
Well, yes, in the book, My Body, My Baby, it's not a book of information. It's a book that once you start reading it, there's a lot of great information there, as well as stories, advice, things that you can do. It's very easy reading. It's very important reading. As many, and I mentioned you've assisted in over several thousand babies, and that was when you were here the last time, so I'm sure that's gone up dramatically during that time. Do you still get that feeling when you've gone through a successful birth and you're there and you actually see the baby and everybody is healthy and happy?
Absolutely. It's like with homeopathy, you energize people. So when women get those, you energize yourself, actually, and it gives you a second burst of youthfulness, because it's so good. It's a wonderful feeling to see this happen and to be a part of it.
When we hear of complications, how many of those do you think could be prevented, as opposed to those that, well, it's just sort of inevitable? You really can't do anything about this. I get the impression that a lot of the complications we could deal with if we just had a little foresight and some information.
Absolutely. I'm thinking, if I take women that come to me high risk. I spoke before, usually India, the food's overcooked, poor diet, poor skin healing, poor social economic circumstances, all those things they come with. So we turn the diet around, we turn everything around, and 95% of them women are not getting complications, and it can actually reduce. I think you can even reduce that. The more I work on it and work with the women and empower them to actually take responsibility and work with me, and it's every week you monitor the baby around 24 weeks. The baby produces a bit more fluid. If they're eating the foods that make you pee a lot, the baby pees a lot, and then they get too much fluid and then the waters go. So you keep saying, you've just got to be on top of it every visit, and every visit takes a half an hour, not 10 minutes, not a quick blood pressure check and a few bloods and out you go.
You talk about bringing art and humanity back to the research around childbirth, and those are interesting words. Let's talk about humanity. Has that been missing when you think back of how we've gone through the process? There's not a whole lot of concern until the actual time of delivery, and then it's sort of a generic process, at least it has been over the years. Is that what's missing, is humanity?
I think so. The connectedness, it's more than a woman and a bed to clear.
Yes.
And a birth gone. There are women out there that are traumatized and they've been to high dependency units, and they actually need, counseling and debriefing, afterwards. We need to speak with them and meet with them so they're not traumatized psychologically. And we know that the genetics come through. So if she's been traumatized, the baby's going to grow up being traumatized. So, it's bringing that back. It's bringing, the closeness, talking not just about the visit, talking about the woman and the family and what kind of day have you had. It's just like you're interviewing me, how's the weather in New Zealand,
Yes.
It's not hard.
Irene Chain-Kalinowski has been our guest on the program. Back for a second time. We will have her back again. The book we're talking about is My Body, My Baby. That's available. If you go to Amazon, you will find other books by her. Let It Be will be coming out very shortly. I don't know when she has a chance to write the books, because you are working so much and traveling around the country. We'll be over in Chicago as honorary scientific advisor for a very important meeting during the course of the summer. The book is really an interesting book and an important book, My Body, My Baby. Facebook.com/My Body, My Baby. Irene, as always, a pleasure having you on the program. You've helped thousands of people. Hopefully we've got the message out to more today. And thank you for joining us once again.
Oh, thank you so much. My fourth book's on the way and almost complete as well. It's called With Woman, With Midwife, With Me, and that talks a lot about connectedness and bringing humanity back. So I hope that makes a difference to caregivers around the world too.
Well, we will talk about that. And I had that in my notes, and it's like she can't keep writing all these books and still work at the same time. So you don't sleep a lot, obviously, is what happens. Irene,
I think that.
thank you for joining us on the program. We look forward to having you back. Thanks, everybody, for listening to This Week in America on the Blue Funk Broadcasting Radio Network.
You're listening to This Week in America with Ric Bratton. More after this.